Hello, my name is Brittany Carter, and today I have the pleasure of taking you through the world of children with autism spectrum disorder and the challenges they face in transitioning into a school setting.
A picture that is quickly going viral. Take a look for yourself. A child with autism wasn't having the best first day of school in Wichita, so one of his classmates went to comfort him and then took his hand and walked him into school.
He was kind to me.
Yeah, he was.
Yeah. I was in first day of school and I started crying. Then he held me and I was happy.
It just warms your heart. You just take a look at that picture again. The children's parents are saying that they hope that this does spark a new friendship between the children.
So in this video, you see a young boy with autism spectrum disorder who is very emotional. It is in this very scary experience as he embarks on his first day of school in a new atmosphere with all new faces and being in the displacement of their own comfort zone. And then you see another child who comes over as he sees him emotional, and he consoles him and grabs his hand and helps him with this transition. So this leads me to the systematic review of transitioning to school for children with autism spectrum disorder. And so the aim of this was to identify the support of a positive start for children with autism spectrum disorder when going to school. Some of the methods that were used were web searches that identify literature, the literature being published after 1991 and relevant to transitions in the process of that for children with autism spectrum disorder. Also, some of the factors and studies and also results that came from these factors: school readiness, how ready the child is, and some of the results that they found were that the children with autism spectrum disorder had the basic skills for entering into a school setting, but as far as those social skills and some of the developmental skills, they weren't exactly ready as other children. Parent and teacher perspectives on transitions and practices. Basically, they were all advocates for early transition practices. Some of the ideas and some of the practices that they do have within the school are allowing the parents and the child to come in and tour the school beforehand. And usually they have this within the orientation or open house, which happens right before school starts. Characteristics of children with ASD that are associated with successful transition into school, and that's also in the study, and the impact it has on school-based interventions. So this leads me to my why. I chose the diagnosis of children with autism spectrum disorder, specifically transitioning into the school setting. As a music educator, I have noticed and I have encountered children usually in pre-K and kindergarten who it's their first time entering into a school setting. It's their first time having to deal with large class sizes or large amount of people at one time, all different sensory processing that they have to deal with, new rules, routines outside of their normal. And I've just seen them kind of fall into, because, you know, as a public school teacher, they have those large class sizes. And so I've always gained some type of interest in trying to figure out what I can do in my practice and in my classroom as a music educator to help them kind of ease some of the tension and discomfort that they're having within this transition, as well as supporting the teachers through music with techniques that they can use to also help assist with those children in their mainstream classrooms. So, what is autism spectrum disorder? Autism comes from the Greek origin, which means self. And in 1943, the autism term was used for children who displayed unusual behavior and social skills. It was also a term that was used for adults who had mental disorder and introverted behaviors. It also moved in the 1944 using the term for children who had large vocabularies. And although this term was used a lot during even beginning in the 1940s, it wasn't until the 1980s that the diagnosis of infantile autism was added to the mental manual of mental disorder. And as this diagnosis continued to evolve, it eventually led to the current diagnosis of autism spectrum disorder. So that leads us to the definition. It's a pervasive disorder, a disability that affects a person's ability to communicate and interact with others. Spectrum disorder just meaning that there are various possible disorders that exist within that spectrum. So we talk about our spectrum under our umbrella, and we have our pervasive developmental disorders, and it shows those disorders that fall underneath. So underneath the autism spectrum, you have autism disorder. You have your pervasive developmental disorder, not otherwise specified, which is also considered PDD-NOS. And this basically describes people who don't fit neatly into any one disorder. And one specific kind of autism, and they vary between the 5. Asperger's syndrome, condition characterized by a greater or lesser degree of impairment in language or communication skills, as well as they display repetitive or restrictive patterns of behavior and thought. Then we have Rett's disorder, which is a genetic neurological disorder. It's also very rare, and it is exclusively found in girls, and it leads to severe impairment that impacts the child throughout their life. And then we have, lastly, our child disintegrative disorder, which is a rare condition also, and it's characterized by late onset, late being anything older than age 3, of developmental delays in language and social functions and motor skills. So, what are the signs? It's important for me to, express that a lot because it's a spectrum disorder, some of these characteristics and signs can be found and cannot be found. Every individual is unique in their own. So as far as communication, there are many things that fall underneath there, such as trouble expressing their needs, trouble understanding feelings, and talking about their feelings, and all of that falls under receptive and expressive language. Also, the child with autism spectrum disorder may be verbal or may be nonverbal. Another thing that comes along with that is they repeat and echo words that someone else says to them, or they put phrases in the place of normal language. The last one I've noticed was reverse pronouns, such as instead of saying I want an apple, they say you want an apple. Following along with that, there's social interaction or social skills, and that's trouble in relating with others or having interest in others, avoiding eye contact, physical contact, wanting to be alone, interacting with others in the more general sense, difficulty developing age-appropriate relationships. Sensory processing is sensitive to high or loud sounds. They also have unusual reactions to the way things smell, taste, look, and feel. And unusual interests and behaviors. So things such as lining up toys or other objects. They don't play pretend games such as playing with a doll and pretending they're feeding them. Repetitive actions such as lining up objects, just like I said before. Trouble adapting to routine changes, and that following getting them getting upset by minor things, such as stopping at the grocery store on the way home from school. If it's not something that they normally do every day, that can cause the child with autism spectrum disorder to get very upset, have tantrums, have a meltdown. And so what are the unique traits to the characteristic? Unique traits. So for a school-age child with autism spectrum disorder, they're often unengaged and isolated on the playground. Slightly involved in the peer networks, basically saying that sometimes, like I've had students, the child that has been diagnosed who's there, and they find their way in some of the activities, but not really. So it's almost like as if they just become a face in the crowd, less likely to be reciprocal to relationships. And one that stuck out to me was more likely to be rejected. So I noticed that a lot of times, especially in the younger children, that it's hard for them to understand that there's differences between the students. And so they struggle with finding relatedness between them. And because of that, instead of, they just reject it. So, but on the greater side, on a positive side, a number of children with autism spectrum disorder, despite their diagnosis, they are very successful in peer in school settings and social interaction with little to no intervention, as well as they can also be verbal, like I said before. So here is a quick video. I'm going to show you just a portion of it. This is a video from the Nationwide Children's Hospital that demonstrates their SMART program for children with autism spectrum disorder. It shows the children engaged in small group activities that addresses many of the communication, social interaction, and developmental goals that the children have with autism spectrum disorder and that they struggle with.
When we got the diagnosis with my son, it was like, okay, what do we do?
2016.
The program is designed to help kids work on socialization through communication and play with other kids while in a structured environment.
It helps them attend and listen better, focus better, follow directions better. Many of the things that come naturally to children who don't have autism, those skills just don't come naturally. Those are things that you have to teach. Oscar did not start out where he was sitting. Oscar, when he first came in, could not regulate himself. When it came time to sit the circle, he would be very angry. He would throw himself on the floor. He would peel his socks and shoes off. As you saw today, Oscar was sitting in circle. He was interacting with his peers. He was attending.
This is just like night and day. He enjoys.
So, where does it come from? What are the causes? So the causes are still unknown, because there is no one single cause for it. But there is a general agreement that the autism is related to abnormalities in the brain structure and function present at birth. But, however, there are risk factors that may make a child more likely to have autism spectrum disorder. So those are genetics, siblings that also have autism spectrum disorder make the child at a greater risk. Certain prescription drugs such as valproic acid and thalidomide, which are taken during pregnancy, have been linked to a higher risk of children developing autism spectrum disorder. Children who are born to older parents are at a greater risk. And then there's also evidence that identifies development of autism spectrum disorder, usually critical before, during, and right after birth. So what are the common treatments? There were a lot that I found, and I'm only going to go over some of them just because of the sake of time, just for the sake of time. But the very first one that came up in a lot of my research was early intervention. In early intervention, was identified to and has proven to improve the development of functions and symptoms that come along with autism spectrum disorder. Then you have your psychosocial intervention, which is a growing intervention for preschool children. Medical intervention is a research identifies many individuals with autism spectrum disorder usually have underlying medical issues, but a lot of the time those medical issues are not undiagnosed, and because of that, it heightens the symptoms of autism that follow along with it. And one that I found very interesting, dietary intervention, which and underneath there are two diets that that was explained, and gluten-free and casein-free. Gluten meaning wheat protein, and casein-free meaning milk protein. And basically taking these parts of your diet out was said to relieve a lot of the symptoms associated with autism spectrum disorder. Another one is specific carbohydrate diet, and is a scientific based diet based on chemistry, biology, and clinical studies. And this is designed for patients that have intestinal disease. While reading, I learned that a lot of the individuals with autism suffer from IBS, inflammatory bowel syndrome, colitis, and Crohn's disease. Other therapies: behavioral intervention, occupational therapy, physical therapy, speech therapy, vision therapy, music therapy. And then the one that really just caught my eye was Canine Companions. And Canine Companions is basically a nonprofit organization that provides highly trained dogs to assist and support and in the development and ensure quality partnerships with people with disabilities. So for more information on the interventions and therapies that I've listed, you can find that at the National Autism Association website, which is www.nationalautismassociation.org. So how does music therapy help the experience? I found many different experiences that followed underneath autism spectrum disorder that had followed along with research and how it helps and supports the treatment of children with autism spectrum disorder. One specifically was improvisatory experiences or clinical improvisation. And basically what that is it falls under the related-based music therapy framework. And the targeted goals that it addresses are relatedness, communication, joint attention, social, emotional skills. The intervention structure is a non-directive approach that uses various instruments and movement with music. During the session, in the music experience, the child is the musical leader and the therapist follows. The therapist can follow with accompaniment on piano or with a guitar. And this is a more free-flowing approach that creates a unique therapist-client relationship. Some important tips to effectively implement this approach that I noticed as I was reading through it was to make sure there are pauses and wait times. And this will allow the child and ensure that the child maintains that leader role in the experience. Also being fully aware and focus on the client as the experience progresses on. So they're able to find those strengths and challenges that are gained through the clinical process. So I'm going to play a quick portion of this, and I know that time is of the essence, but this was the most perfect example that I could find that shows the improvisatory experience with a non-directive approach and what that looks like with a child with autism spectrum disorder.
Little loud, it gets little loud. is hanging out with his friends. So he asks for a
I hear something.
he asked for a
Ask for
ask for say it.
How as much as I would love to continue on with that video, if you get a moment, you can look at it. Very, very inspiring. So the last part of this, and I won't go fully over all of it, but I will explain. This is another study that I came across in my research that talks about the benefits of augmented and alternative communication systems for children with autism spectrum disorder. That basically helps and aids in a child who struggles with receptive and expressive language. And the journal describes the functions of the AAC systems and how they can be implemented in all areas of life of the individual with autism spectrum disorder, including music therapy. The journal also identifies the lack of training that music therapists have when using these communication aids, and they suggest additional training and assistance to embrace the practice model. So, for my closing remarks, as you can see, I tried my best to condense all of this information. I was able to have a numerous amount of available resources for this specified population. Prior to the beginning of this journey to becoming a music therapist, I always found an interest in working with children with disabilities and have met so many very special individuals um, throughout my teaching experience with early childhood and elementary education. And as many of those experiences have really affected me in, going not only going along this journey, but also finding an interest in possibly making this the diagnosis that I practice. So, in saying all that, I hope that you enjoyed this presentation and were able to gain a better understanding of children with autism spectrum disorder. Thanks for your time.
You got a friend in me. You got a friend.